Hello, my name is Ted Mitchell, Senior Account Manager at Optum RX. Welcome to your 2024 Prescription Benefit Overview. This presentation is intended for members utilizing prescription benefits offered by the Michigan Public School Employees Retirement System, as administered by Optum RX. To assist you in finding information quickly, this presentation has been divided into sections. The recording will focus on the following areas of interest: 2024 plan updates. This section will highlight the key changes for 2024. Key terms and cost share. This section provides helpful definitions, explains your cost share, and annual coinsurance maximum. Maximizing the value of your plan. This section will cover cost-effective drugs, home delivery, and specialty pharmacy. Helpful resources. This section provides information about digital tools and member communications. Finally, how to contact Optum RX. We will now discuss your 2024 plan updates. These updates will provide you with more options when filling your prescription at your local retail pharmacy. With the 10% additional coinsurance no longer applying, members can purchase a 30-day supply at retail with no additional cost. For maintenance medications, it is still recommended that you fill a 90-day supply, as it is often the best value. DiviDose Pharmacy will simplify managing your medications. More information will be provided in the Maximizing the Value of Your Plan section of this presentation. In 2024, non-Medicare members will have more options when filling medications. Same as Medicare members, the 10% additional coinsurance will no longer apply when purchasing a 31-day supply at retail. You can now purchase a 90-day supply from an in-network retail pharmacy as well as Optum Home Delivery. Members are no longer required to use Optum Specialty Pharmacy. However, members will receive lower costs exclusively through Optum Specialty. For coupon card users to more accurately reflect true out-of-pocket costs, members will receive credit towards their out-of-pocket maximum for the amount of a drug copay that they actually pay out of pocket. As previously stated, more information on DiviDose to come. Now, let's focus on your out-of-pocket costs for 2024 by discussing the benefit basics. In order to understand your cost share, it is important to be familiar with certain terms that I will be referring to throughout this section. Tier determines the medication cost. The lower the tier, the lower the cost for the medicine. The higher the tier, the higher the cost for the medicine. Cost share, the share of cost of a covered drug that you pay out of your own pocket. This term generally includes coinsurance and copayments or similar charges. Coinsurance, the percentage of cost you pay for a covered medication based on tier placement, 20% for example. Annual coinsurance maximum. The annual coinsurance maximum limits the amount you pay for a covered drug, coinsurance, and copays. Formulary, a list of prescription drugs covered by a prescription drug plan or another insurance plan offering prescription drug benefits, also called a drug list. Maintenance drug, prescribed medication that is taken over a long period of time for an ongoing or recurring condition. For example, blood pressure and diabetic drugs would be considered maintenance drugs. Specialty drug, high-cost medications such as oral, injectable, or inhaled medications are defined as specialty if they require ongoing clinical oversight or extra education, have unique storage or shipping needs, may not be available at retail pharmacies, or may require infusion. Let's look at the 2024 cost share for Medicare members. For generic and preferred brand name drugs, the member cost share is 20%. This coinsurance includes a $15 minimum copay and a $45 maximum copay per 30-day supply. The 90-day coinsurance includes a $37.50 minimum copay and a $112.50 maximum copay. A 90-day fill of a generic or preferred brand name drug is your best value. For non-preferred drugs, the member cost share is 40%. This coinsurance is combined with a $15 minimum copay per 30-day supply and a $37.50 minimum copay per 90-day supply. Please note that all non-preferred drugs do not have a maximum copay. All specialty medications are classified as Tier 4 and Tier 5 and are broken into two categories, preferred and non-preferred specialty. Preferred specialty drugs will have a coinsurance of 20% with a $50 minimum copay up to a $100 maximum copay per 30-day supply. All non-preferred specialty medications will have a 40% coinsurance with a $50 minimum copay and no maximum copay per 30-day supply. Specialty medications are limited to a 30-day supply. Specialty medications dispensed outside of Optum Specialty Pharmacy will have the non-preferred coinsurance of 40% with a $50 minimum copay and no maximum copay per 30-day supply. For non-Medicare members, here is your 2024 cost shares. For generic and preferred brand name drugs, the member cost share is 20%. This coinsurance includes a $15 minimum copay and a $45 maximum copay per 31-day supply. The 90-day coinsurance includes a $37.50 minimum copay and a $112.50 maximum copay. A 90-day fill of a generic or preferred brand name drug is your best value. For non-preferred drugs, the member cost share is 40%. This coinsurance is combined with a $15 minimum copay per 31-day supply and a $37.50 minimum copay per 90-day supply. Please note, non-preferred drugs do not have a maximum copay. Specialty medications are broken into two categories, preferred and non-preferred specialty. Preferred specialty drugs are Tier 4 and will have a coinsurance of 20% with a $50 minimum copay, up to a $100 maximum copay per 30-day supply. All non-preferred specialty medications will have a 40% coinsurance with a $50 minimum copay and no maximum per 30-day supply. Specialty medications dispensed outside of the Optum Specialty Pharmacy will have the non-preferred coinsurance of 40% with a $50 minimum copay and no maximum copay per 30-day supply. Let's take a moment to discuss copay minimums and maximums. Here's how it works until you reach the annual coinsurance maximum. If the drug costs less than the per drug minimum, you pay the cost of the drug. For Tier 1 and 2, generic and preferred drugs, if the drug price is greater than the plan minimum, you will pay 20% of the drug cost up to the maximum copay, and your retirement system pays the rest. If the 20% of the drug cost is more than the plan maximum, you pay the per drug plan maximum copay, and your retirement system pays the rest. For non-preferred drugs and specialty drugs purchased from a non-preferred pharmacy, you will pay 40% of the drug cost with no maximum. Let's discuss the annual coinsurance maximum. The annual coinsurance maximum protects you financially by limiting the amount you pay for medications. The annual coinsurance maximum remains $1,750 per calendar year and will reset on January 1st, 2024. When you use generic or preferred brand name drugs, the full amount you pay is applied to the annual coinsurance maximum. When you reach the annual $1,750 coinsurance maximum, you pay zero for generic and preferred brand drugs for the remainder of the calendar year. For non-preferred drugs, only a portion of what you pay is applied to the annual coinsurance maximum. You pay 40% for Tier 3 non-preferred drugs, but only the amount equivalent to the Tier 1 and 2 cost share is applied to the annual coinsurance maximum. After the annual coinsurance maximum is met, members using a non-preferred product will still be required to pay a copay. The copay will be reduced by 20% up to the plan maximum. For Tier 4 specialty drugs, which consist of preferred brands, the full amount you pay is applied to the annual coinsurance maximum. When you reach the annual $1,750 coinsurance maximum, you pay $0 for preferred specialty drugs for the remainder of the year. For Tier 5 non-preferred specialty drugs, you pay 40% for non-preferred specialty drugs, but only 20% up to the $45 plan maximum is applied to your annual coinsurance maximum. After the annual coinsurance maximum is met, members using a non-preferred product will still be required to pay a copay. The copay will be reduced by 20% up to the plan maximum. This also applies to all specialty medications dispensed outside Optum Specialty Pharmacy. Let's take a look at a 90-day copay example for a generic or preferred brand name drug. Reminder, the member cost share is 20%. The 90-day coinsurance includes a $37.50 minimum copay and a $112.50 maximum copay. A pharmacy retail price of $1,000 per 90-day supply is only $112.50 member cost share, and the full amount goes towards the annual coinsurance maximum. Now let's look at a 90-day, non-preferred, brand name drug copay example. Reminder, the member cost share is 40%. The 90-day coinsurance includes a $37.50 minimum copay with no maximum copay. A pharmacy retail price of $1,000 per 90-day supply is a $400 member cost share, but only $112.50, or the amount equivalent to the Tier 1 or 2 cost share, is applied to the annual coinsurance maximum. Let's take a look at a 30-day copay example for a preferred specialty brand medication, which is Tier 4. Reminder, the member cost share is 20%. The 30-day coinsurance includes a $50 minimum and a $100 maximum. A pharmacy retail price of $3,000 per 30-day supply is only a $100 member cost share, and the full amount goes towards the annual coinsurance maximum. Your cost share will be impacted if not filled through an in-network specialty pharmacy. For a specialty, non-preferred brand medication, let's look at a 30-day copay example. Reminder, the member cost share is 40%. The 30-day coinsurance includes a $50 minimum copay with no maximum. A pharmacy retail price of $3,000 per 30-day supply is a $1,200 member cost share, but only $45, or the amount equivalent to the Tier 1 or Tier 2 cost share, is applied to the annual coinsurance maximum. Let's turn our attention to how Optum RX can help you receive the most value from your pharmacy benefit. Going generic maximizes cost savings. Tier 1 is comprised of generic drugs. Generics have been on the market the longest, first as brand products, and then, when the brand's patent has expired, as generics. Since generics have been around a long time, their safety and efficacy have been proven, and they are value priced to save you the most money. On average, generics will provide an 85% savings over their brand name counterpart. Ask your doctor or pharmacist, is there a lower cost alternative that is right for me? If a generic is not available or isn't quite right for you, staying preferred is the next best option. Use our digital tools to discuss pricing with your doctor to see what works best and is the most cost-effective for you. The quantity of medication filled affects what you pay. When you have an acute condition, like a sinus infection, you will generally receive a 30-day supply of a drug. However, when treating an ongoing condition with maintenance medication, a 90-day supply is in most cases the better value. Maintenance drugs are those taken on a regular basis to treat chronic conditions such as high cholesterol, high blood pressure, or diabetes. 90-day supplies are recommended for when therapy plans are already defined and tested. If you're working with your doctor to determine what dosage and strength will work best for you, we recommend 30-day supplies during this learning period to avoid waste. Once you and your health team have determined the dosing regimen that is best suited for you, 90-day fills offer a more cost-effective and convenient way to access your maintenance medication. Retail pharmacy drug prices can vary. Some retail pharmacies have in-store programs that may offer additional savings. You can find a nearby retail pharmacy by using the pharmacy locator tool at OptumRx.com or on the mobile app. You may also call the phone number on the back of your member ID card. Home delivery offers retirement system members many advantages when compared to walk-in or retail pharmacies. These advantages include affordability. Your plan offers savings when filling 90-day fills. Better adherence. Members utilizing prescription medication delivery are more likely to take their medication regimens as prescribed. Studies indicate mail order utilizers are less likely to have unintended breaks in medication therapy, increasing overall health outcomes. 24/7 access and reminders. Speak to a pharmacist who can answer your questions anytime, any day. You can even set up text and email reminders to help you remember to take or refill your medications. Convenience. No more wasted time and gas with trips to the pharmacy. Have your medications delivered discreetly and safely to a location of your choosing. Free standard shipping. Your medications will be safely delivered to your door free of charge within 7 to 10 days of your order. Express shipping is available at additional cost. For medications with temperature considerations, Optum RX uses industry-leading packaging techniques to keep your medications safe from the elements. For members who are currently using our home delivery services and access our website, you can track your medication shipments. When receiving a new medication, you could choose one of these ways to fill your first prescription using Optum RX home delivery. E-prescribe. Ask your doctor to send an electronic prescription to Optum RX home delivery. Online. Visit OptumRx.com or use the Optum RX mobile app. From there, you can fill new prescriptions, transfer others to home delivery, and more. Phone. Call the toll-free number on your member ID card to speak to a customer service advocate. Once Optum RX receives your order, your medication should arrive within 10 business days. Completed refill orders should arrive in about 7 business days. Optum Specialty does more than fill your prescription. Optum Specialty offers extra support to help you manage your care. We also provide pharmacists who are available by phone 24/7. Live video consults with expert clinicians specially trained in your condition. Timely delivery and shipping in confidential, temperature-sensitive packaging. Support through medication and condition-specific programs. Medication-related supplies at no additional cost. And members can receive lower cost exclusively through Optum Specialty. DiviDose is a full-service pharmacy that pre-sorts your prescription medications, vitamins, and or supplements by day, date, and time. They put it all together and send you a box for each month. No more sorting, no missed doses. Using Optum RX's powerful digital tools, you can get help and answers to your questions with just a few clicks. Using OptumRx.com and our digital tools is a fast, easy, and secure way to get the information you need to make the most of your pharmacy benefit. On our website, you can compare medication prices at different pharmacies, locate a network pharmacy, manage medication for covered dependents and spouses, and view real-time benefits and claims history. If you use home delivery, you can also use the member portal to transfer retail prescriptions to home delivery, track orders, or refill home delivery prescriptions. In order to access these tools, please register at OptumRx.com using your name, date of birth, address, phone number, and member ID. Become totally self-sufficient with the Optum RX web portal. Quick actions. The more complex healthcare becomes, the greater the need for convenient access to easy-to-understand information. Optum RX simplifies the experience with self-service tools and provides actionable alerts along a member care journey. When you log into the dashboard, it displays important information all in one spot, including alerts, order notices, and actions you need to take, such as renewing, refilling, or otherwise addressing a prescription. With one-click checkout, easily renew or request a refill from your provider with one simple click, all from a mobile device, tablet, or computer. Complete common actions in 3 clicks or less. Refill a prescription, track an order, price a drug, or view benefits and claims. My Prescriptions. We've made managing your prescriptions easy. You can easily view a listing of current and past medications from home delivery, retail, and over-the-counter. If you need to reorder prescriptions, you'll save time as past medications are listed for simple searching. Order status. Real-time order tracking prevents delays and keeps your orders moving. The order processing page shows when an order has been received, processed, shipped, and delivered. Real-time order tracking notifies you when an order is on hold, the reason for the hold, and what is needed to resolve the hold, allowing the order to move forward without delay. You can receive order refills via email or text without having to sign in. To set this up, select a preferred method of communication on the website. Then you will be able to act on any notification that you receive. Member tools. Search for drug information, alternatives, or price a drug using our intuitive pricing technology. The Information Center offers more than just forms. It's an online resource that provides trusted information. Members will find claims, home delivery, physician facts, and other forms, FAQs, and other details about their prescription benefits and processes, important updates from the FDA, and information from reputably sourced articles. Benefit and claims. Claims and projected cost information is now available at your fingertips. You can access accumulator summaries, cost-sharing requirements, and expected out-of-pocket costs. Under claim details, you can see what the plan covered and what you will be charged or have paid. If there's an opportunity to save on that medication, an alert will detail how. If a medication requires a prior authorization, you can request it. This will allow your order to continue without delay. And last but not least, having all claims in one location also makes it easier at tax time. My Profile. You can modify your profile and program options to fit your lifestyle. You can manage communication preferences, reminder notifications, or even go green and reduce paper. Set up personalized reminders or optional text alerts. Manage accounts, passwords, and address management. Going south for the winter? You can make a one-time shipping address change. And opt in or out of Optum RX's time and money-saving home delivery, automatic refills, and more. Electronic delivery. Optum RX makes it easy for you to get documents related to your benefits by email. These include benefit and plan information, claims summaries, explanation of benefits, billing and payment, pharmacy care information, and tax documents. You are eligible to get this information through Optum RX's member website. If you choose to do this, you will get an email each month when your claim summary is ready to view online. The Optum RX mobile application. The Optum RX mobile app offers a lot of the same features as OptumRx.com. No more searching. With just a couple clicks, you will have the tools to manage orders, connect with care providers, find cost-saving options, and make informed decisions by searching reliable information from trusted sources from anywhere, anytime. The dashboard displays important information all in one spot. This includes alerts, order notices, and actions to take, such as renewing or refilling. With one-click checkout, easily renew or request a refill form from your provider with a simple click, all from your mobile device. Before you even leave the doctor's office, send in for the order status or the price of a drug. At any time, from one of these pages, you can click on your cart and check out. The updated, consumer-friendly user interface makes it easy for you to manage your account without having to call customer service. Real-time order status prevents delays and keeps your orders moving. Order Now allows you to quickly add any refillable medications to your cart and check out in just a few clicks. Order Status allows you to track where your order is every step of the way from any device and keep it moving. Simply select the order that you want to track and a visual image will show you where your order is in the process. Easily access the medication order number, date, when it was delivered, and cost. The order processing page shows when an order has been received, processed, shipped, and delivered. It also displays the reason for any hold and what actions you should take to remove the hold, offering multiple ways to submit an order and real-time tracking from order entry to delivery. Order refills via email or text without having to sign in. All you need to do is to set up your preferred communication method on the website. From there, you can act on any notification that comes through. No medication pricing ahead of time. Drug pricing is fluid and changes daily. This can make it challenging to price medication or even understand all of the different places to look. The mobile app provides real-time pricing that's available anytime, anywhere through a simple and secure digital member portal. We are committed to making it easier for you to find the best price for the medications right when you need it, whether you're at the doctor's office, the pharmacy, at home, or at work, online, or on the phone. Organize your medications. Same as with the website, we've made managing your prescriptions easy. View a listing of current and past medications for home delivery, retail, and over-the-counter. If you need to reorder an older prescription, you'll save time as past medications are listed for simple searching. Automated refill communications. Medication management can be overwhelming. Automatic prescription refilling helps you keep on your medication schedule. It eliminates the need for you to remember to request a refill and narrows the chance of missing a dose, which can be harmful to your health. Never miss a medication again with refill reminders. These are push notifications that are sent to you automatically, allowing you to open the app so you can take immediate action. Automated reminders makes tracking adherence and refilling medication simple, enabling informed decisions via the Information Center. The mobile app empowers you to research everything from side effects to common uses. With better information at your fingertips, you can make more knowledgeable healthcare decisions. In the Information Center, you will find forms for home delivery, physician facts, and other forms, reputable videos, FAQs, and other details about your benefits and processes, important updates from the FDA, and more. Thank you for listening to Optum RX's presentation. If you have any questions, please contact Optum RX where your questions will be answered. Customer service agents are available 24/7, or you can visit the member portal at www.optumrx.com. Please remember to visit Optum RX in the Learning Center for additional information. We hope that you found this overview of your prescription benefits valuable. We look forward to being part of your healthcare team for the upcoming year. Thank you.